Welcome to McColl Center Art Talk, the intersection of chaos and creativity with Anna G. Dean. My name is Claudia Gonzalez Griffin, Director of Residencies and Programs. Before I introduce our guest panelists, I want to share with all of you who we are. McColl Center is a nationally acclaimed artist residency and contemporary art space committed to putting artists first with 360 degrees of support, including artist studios, modern equipment and tools, and exhibition spaces. Beyond serving as a catalyst for artist advancement, McColl Center is a hub for connection with the creative community. This is a place where all are welcome to share in a universal passion for art and inspiration to creative participation and engagement. And now I want to introduce you to McColl Center Atrium Health Artist in Residence, Anna G. Dean. Anna lives in Fort Mill, South Carolina, and creates sculptures, videos, digital manipulation pieces, and mixed media collages. Our guests are Ruth A. Krostopolsky, Senior Vice President of the Population Health Division at Atrium Health, David W. Calloway, Chief Medical Officer, Department of Emergency Medicine, Ron Turner, Senior Manager, Atrium Health Invest, Community Engagement and Corporate Responsibility. And finally, Jonah Logan, McColl Center for Art and Innovation Creative Director, who will lead this conversation. Jonah?
Thank you, Claudia, for the awesome introduction. And thank you all for being here this evening. I'm looking forward to this conversation because I think it's our relationship. And this opportunity is a chance to really kind of talk about medicine and creativity and the ways that community kind of affect, or the way, I say it this way, the way that COVID has affected community, and the way that I think community is reflected at Atrium. Because when we think about like hospital spaces, I think we often consider going there to get treated, right? But there's a broader relationship with community. There's a greater understanding of kind of what's happening. And there's an exchange, I think, between what's happening in our neighborhoods and the way that people are being affected, and the ways that medical spaces, hospitals, Atrium responds to community. So I think it's a really kind of dynamic space to talk about and to look at. And I'm also really interested because I know that all of you have had conversations around this work. And I just kind of want to hear what they are. So I'm like really interested in kind of unpacking like what some of the dynamics have been in supporting and working with Anna. And just for everyone, Anna is a resident at McColl Center, but she's specifically the Atrium Health resident. And McColl and Atrium has had a relationship since 1999, where we place an artist annually in residence. And so they work with the health system to really kind of think creatively and kind of unpack some of the dynamics and issues and the ways that people are looking at health through their work. And so I'm really excited about this. Also, as I said, this is a moment where we have all had to be creative and to rethink how we're engaging and working with each other, and what the ramifications, I think, of COVID have been, and what it will be in the future. Because I know that we're all optimistic. The news keeps telling us that we're in this moment, and I feel it, but we have to recognize that this is something that will continue to affect us. So with that said, I want to kind of get into the conversation, but I want to make sure that you are able to introduce yourselves a little bit more to the group. So Ruth, can we start with you?
Please. Sure.
yourself.
So I'm Ruth Christopolsky. When I introduce myself outside of work, I always say first and foremost, I'm a mom. And I think that's important in the work that I do every day, because I spend a lot of time thinking about how do we improve the health of the people in our communities and ensure that the places where we live, work, and play are the healthiest possible. And so I was really excited to be included, because when I think about the health of people, I think about it holistically, and the impact of art on our underlying health, I think, is very important. So thanks for having me.
So, David, would you like to introduce yourself?
Sure, thanks. I'm Dave Calloway. I'm an emergency medicine physician at Atrium Health, Maine. I've been here for about 10 years. I spent some time in the Navy and spent a little bit of time overseas when I was younger. And then I mostly work in crisis now. I was raised by a single mom in Minnesota who owned an art gallery, and instilled in me at a very young age an appreciation for the arts. And my father was a physician who was a lover of music and literature as well. And somehow I felt, the apple fell very far from the tree and rolled all the way down the hill. But, I think that what I have found over the last 5 years, as I've gotten into fatherhood, to Ruth's point, is that my reason for doing things has dramatically changed. There's always this, ethereal sort of do right, do good mission. But, now every morning I wake up and I look at my two daughters, Elizabeth and Liliana, and their mother, Jenny, who's a physician and Cuban American. And I think, how do I make this world a better place for them? How do I make the world better for them in 2030 and 2050? That really, is a different type of emotional motivation that really gets me through the days. And I'm really happy to be here. It's great. Thank you for having us.
Thank you. Ron, how about you?
Hi, so I'm Ron, and obviously I feel very humbled and honored to be on this panel with Ruth and Dr. Calloway, and just to talk about the project with Anna. And I know we'll ask some questions later about how we got involved in that. But outside of work, my world is art. So I am a musician and an artist on the stage for theater, and so of course. When this opportunity was presented to me, I was like, absolutely, I will jump in it. And I had no idea what we were getting into, but I'm truly excited that it has taken the path that it has taken, and that the professionals that we have gotten involved are the ones that are a part of this. Obviously, to talk to Anna, it's like I could continue to pull people all day long to give her folks to talk to, and at some point she just said, I've got to get the project done right. So I'm truly excited. And the one thing I think probably to kind of piggyback off of Ruth and Dr. Calloway is that I don't have any kids, but I was raised by a single grandmother, and all my life, the only thing she gave me was humility. And she always told me that when you die, you should die empty. Give everything that you have while you're on this earth, so that when you die satisfied. And so that is what I want to do, is help to enrich the world just by being a part of it. So thanks for having me.
Absolutely. Thank you. And Anna, tell us about yourself.
So I am currently artist in residence here at McColl, and I am also teaching. I teach art in the morning at Fort Mill High. I'm a mom and a wife, and I'm very, very grateful to be here and to be a part of this project. So.
Thank you. So let's get into it. And Anna, we'll start with you. I think partially because, the work that you've been doing, all of this is inspired by your work, right? So we should kind of start there. Can you talk a little bit about, one, why you were interested in this particular residency? And then why COVID for your focus?
So prior to this, I was an MFA student, and I was supposed to graduate last May. And when you're in an MFA program, you spend 3 years basically focused on one topic, and you're building this body of work based around that. And my topic was chaos and order and the man-made and natural worlds. And I had created all these giant pieces that were so huge that I had never even seen them. I didn't have a space to put them all together. So it had only existed in my head. And I was up on a ladder installing a projector, and it was all about to come together. And then they ran me off campus and said, the governor just shut down the state. You've got to get out of here. And I was like, what? Like right now? So I spent like 3 days just sitting in my backyard, staring at the clouds, like trying to figure out what I was going to do, which felt very chaotic, but I know the whole thing felt very chaotic to all of us. And so at some point it dawned on me, like, this is what your research is about, like chaos. And the hospital to me is like this big organized system that's like trying to figure out how to make order out of all of this chaos. So when I saw that there was a call to artists, and it was a partnership with Atrium Health, it was the perfect fit. And so I jumped on it. And it's been fascinating. Always for me, art has been like a space where I can investigate ideas that exist beyond language. When there's something that I can't wrap my brain around, I can go in the studio and use my hands and work my way through things. And I felt like I needed that time to understand what was happening in the world. So I feel incredibly, incredibly blessed and privileged that I've gotten to have a front row view through Atrium and to see what's unfolding. I've been like along for the whole ride. So it's been really exciting.
And what did that look like? So you talk about the ride and like being in this process. I'm curious to start with you, but generally, right, to all of you, like what did this process look like? And how did you all kind of experience it to ultimately get to what's starting to be created behind you? And we'll get to that, but I just wanted to call it into the room as well.
Well, I knew I had this residency and I knew my time. COVID was happening so quickly and everything was changing, and I knew I couldn't wait until my actual residency started in January. So my research actually began pretty much as soon as I found out that I had it. And I started with a map, and I started tracing Charlotte street by street, which was hundreds of hours, but I needed to understand the sense of place, and I needed to understand the lay of land. And after that, I started looking at heat maps, the DHHS, I think I'm saying that correctly, but they post it every couple days, and it's like by zip code, it shows you how many cases are in each zip code. And I started taking screenshots of those heat maps, and I put them in Google Slide, and within the first month of data, I could see a really clear trend. There were certain areas of Charlotte that were getting hammered by COVID, and nobody went completely unscathed. All the areas of Charlotte were getting touched, but there were certain areas that were getting way more cases than others. And so that's where I started. And that's when Ron, and maybe he can speak about this, but he started pointing me in the right direction for interviews. And I started interviewing some people at Atrium that actually work with the underserved populations. And so they helped me understand why the map looked the way it did. So that's where it started.
Yeah, and I can just kind of talk a little bit about the process to get her there, Janelle. We obviously went through the normal routine of looking through all the applications that came through, and we narrowed it down to several. And Anna's just spoke to me from the very beginning. And of course, when you're dealing with multiple people that are looking at multiple applications, they all have reasons why their particular artist or particular applicant is the one that we should choose. So I was very adamant that Anna had to be the one. I just said she has to be the one. There's something about this. And so Matt and I actually ended up in agreement on that. Matt is my director, and we talked to Anna and we interviewed Anna, and I just felt she's going to be able to help us tell a story that words can't describe, right? And just seeing some of her previous work. And I said, well, let's get her in here. And of course, as soon as we did the interview and started talking to her about how we could get her interviewing the right folks and the Dr. Passarettis of the world, Dr. Calloway, Ruth, Keneal Coltman, who is our Senior Vice President for Community and Social Impact. So, I mean, those were the people that in my brain, I was like, this is who she needs to talk to. And as she began to interview these folks, they began to say other names of different folks. And then there was the mental health and behavioral health aspect of it. And just, so the process just kind of unfolded itself, so to speak, right? And then, of course, we rolled into the world of vaccines. And then so she got to be able to come out and see some of how the operations for vaccine world was. And so it's just, the process continues as we speak. So that's kind of how we got to where we are.
So Anna, you brought up, and thank you. And so I'm gonna ask a general question because I'm not exactly sure who to target the question to, but it goes to something you said about your early research, that you were looking at maps and noticed that there were kind of hot spots. Can someone kind of talk about like where these hot spots are and what, why we believe that that was happening in those areas?
I can take that. It's the work that I have the distinct honor of doing almost daily, right? And so within every community, there are areas where drivers of health that are outside of just the pure physical health needs that people have, impact them at a greater level. So lack of access to transportation, to whole and healthy foods, and sometimes even access to healthcare really have an impact on the overall health of a person and in particular specific population. So there are 7 priority zip codes around the city of Charlotte, mostly to the north and west, where we have historically seen significant variations in life expectancy, prevalence of disease, outcomes from particular chronic conditions. And we were aware of that. I think what was not surprising, but very, very visible as as COVID started to roll along, was we were seeing higher rates of incidence of COVID and transmission in the communities, and they're particularly communities of color in those areas. And there's a whole host of reasons for that. Our communities of color are our frontline essential workers. So they were out there being exposed more than others are. There are multiple individuals living in housing, right? Some of us live in houses where we can be in separate rooms from the rest of our family members, and many of the individuals that live, in the 7 zip codes around the city to the north and west are in multi-generational housing, closer spaces, and so the ability to protect and separate wasn't there. And so I think for many of us who do this work every day, who understand the very stark differences in health and health outcomes across the Charlotte community and the surrounding region, the light up that Anna saw was directly related to and copied what we see in rates and incidence of disease and mortality, morbidity, and outcomes. And so for me, I was just so pleased that we were going to take a moment in time and capture what is once in a lifetime, right? To say, this is what happened. This is what happened to the people in our community. And then express that visually. So I got really excited when I thought about, we're living through a moment in time that, it's been probably 3 generations since, folks lived through kind of this moment in time, and to capture it in perpetuity, I think, if somebody 100 years from now is going to look at Anna's work and understand what our community went through, as COVID kind of rolled through.
Sorry, I do this. So And it's interesting to hear you kind of talk about this moment in time. And it raises actually two questions. One, I definitely want to kind of talk about, Anna, how you kind of captured this moment in the work. But then Dr. Calloway, I also would love to kind of hear you talk a little bit about this moment in time and kind of what some of the things that you navigated, observed, share with Anna that really kind of inform the work. I think it would be great to hear that so that we can, when we look at the work, kind of think about how it applies.
Yeah, thanks, Janelle. Well, so just briefly, also, I wanted to thank Ron and Anna just for the opportunity to be involved in this. It's been an emotional and reflective experience. So I appreciate the McColl Center and Atrium sponsoring it. But Ron, in particular, he and I had done some work on the masking initiative, and he's had to deal with my insanity for a while. But it was an honor to be able to engage. I think there are a couple things, Janelle, to your point. One is, and you've heard this, like we live and learn by stories. I mean, that's how humankind and society and communities have evolved. And the stories are written, or they're told, or they're expressed in music, or they're expressed in art. And oftentimes the most powerful stories are expressed in all those different mediums. And the thing about both art and healing and what we've seen here is, art requires curiosity, and it requires love and reflection and sacrifice and connection. And those are all the same things that are required to have a strong community. And those are all the same things that are required to heal, right? So, I can fix a broken bone by setting it, but, there's an argument that I really haven't healed anything, right? And so the healing process is longer, and, at its core, you need to have curiosity and joy. And it's odd to speak about curiosity and joy in the setting of a global pandemic, but what I'd offer is that's how we get through it, number one. But number two, that's where we find the opportunity. And not to be too like crass about it, but Ruth's work on social vulnerability or social determinants of health, as indexed by what we call the social vulnerability indices, and there are 18 of them or 20 of them. Like we've known what they are for decades, and there's no mystery to the intersection of health and education and diet and stable lodging and transportation. It's a complex problem, but we've known it. And the fact of the matter is, society doesn't address problems until there's a crisis. And so what COVID did was it laid bare these very issues that have been plaguing us for 2 decades. And then what Anna's work and the data has allowed us to do is take really powerful data and then merge it into a very powerful story that then challenges society to say, is this who we are? I mean, are we going to let people within our society succumb to these inequities or not? And there's no hiding it. There's no sugarcoating. There's no, with diabetes and hypertension, which are all like high in these areas, those are 20, 30, 50-year problems. And people can just kind of push it off, say, it's not in my face. And COVID put it in your face. And again, I think Anna's work puts it in your face, and you have to look at it, and you have to think about it, you have to be reflective. And so I think it's, we're in a powerful time, and you guys are telling a great story.
So Anna, tell us about your story. Like talk to us about the work a little bit, and like how like you've put it together, or what is the process, because it's not finished yet. But then also I would love for you to kind of talk about the involvement, right, that is also a part of the work.
So the story that I originally thought I needed to tell was about like why certain areas were getting hit worse than others, and what that told us about Charlotte community and what we had learned from it. Like I thought that was the story. And then I talked to Dr. Kristopolsky, and she said, I understand that you're getting all this data and this information, and that's not all of the story. That's one piece of the story. That's one layer of the story. This whole story is so multi-layered and so multi-dimensional, and there was more elements that I needed to tell. And so I started to talk to people and ask them, you know, out of all of this, what were our lessons? What were our, and I was calling them pearls, you know, what are, when a shell gets an invasive body, when it gets a piece of sand inside of it, it builds a layer of protection around itself. And that invasive body becomes something really beautiful that's unexpected, and that's unique and precious. And so I feel like this moment has offered us an opportunity to find beauty in all of this darkness. And one thing that I kept hearing over and over from everybody I spoke with at the hospital is they thought the Atrium Healthcare was this big machine. They felt like it was this big giant machine that was too big to like change. But it was because of the sense of urgency that it required, the hospital had to reinvent itself and had to reinvent the way that it treats patients. And it had to step outside of the walls, the boundaries of the hospital system, and actually out into the community. And a lot of people said this was the first time in their career that they have felt like the hospital system was treating not only body, but also mind and soul. And so that's where I came up with these idea of these triangles, because a triangle is 3 points. You know, it's not a box. A triangle also is the arrow that's moving us forward. And so that's going to be another layer that comes off of the panel. And then on the other side, like, so I'm going to start talking about this because I can't not reference it. So I'm working on 2 pieces right now. I'm working on this big panel that's 12 feet long, and I wanted it to feel long because that's how this thing feels. Like it just keeps going and going and going and going. And very early in the pandemic, it felt really dark, like we were in this hole and we might not come out. And so I wanted to capture that. And then I'm using this ink, and it's black. And when you mix it with alcohol and water, it disperses and it turns green. And I feel like that green color is like the water around here. If you've ever, you know, jumped in the lake, it's got this green tint because of the tannins of the leaves that dye the water. And that's how it felt, like this feeling of being underwater and, you know, disoriented, and you're holding your breath. All of us are holding our breath. So I feel like that color was important. The way that I made the ink disperse was by breathing on it. So I blew on the ink, and that's what made it spread. And so it's going from really black to kind of starting now to get towards white, because I feel like there's some hope. You know, we were kind of heading toward a surface. We were able to finally, hopefully soon, come up for air. I got my first vaccine. So I felt that feeling of hope, especially after having been immersed in all this stuff for months. I cried. It was very emotional because I've seen what went into that. I've seen firsthand because of Ron and volunteers and people from the community coming together to make this happen. I think that was an important part of the story too, is that this was a community response. And I think Dr. Calloway said it was a network approach. You know, it wasn't one person didn't make all this happen. We all had to come together to make this happen. And so those were some important other layers that are going to become a part of this element. But it was thanks to everybody that I've spoken to that's opened my eyes, because I'm not in the hospital system. I didn't get to see all of this stuff happen. But I think there are important parts. Like, for example, when I spoke with the head of chaplains, he was saying that, you know, early on, he was holding people's hands in the hospital while they're there and they don't have their families with them to say goodbye. And he asked for iPads so that the patients could see their families, and the community stepped up and donated iPads. And, you know, Ron was telling me that they had, so before this happened, and the community partnership relationship was mostly the hospital giving money to organizations, right? But early when this happened, the hospital, money couldn't buy PPE. There was no PPE. So people in the community, like grandmas, had to dig through their pantries and pull out their latex gloves and, you know, make their masks out of Christmas fabric. And I mean, I just think that's really beautiful. Like, this was so dark, but there were some really beautiful moments. And I feel like that's another really important layer of the story that needs to be told.
You referenced the triangles. And I know that some of you were part of the process. Can you share those and talk a little bit about them? And like how they'll be integrated? Because you talk about dimensionality. I think if you could, just kind of unpack it a little bit.
So there's a whole lot of layers that are going to go on this piece. I wonder if I walk you over there with my laptop, I wonder if you guys can actually see this. So I started with, there's news headlines in here because at some point the news, people like me that weren't in the hospital system that are like in our bunkers and we're like, what's going on out there? We don't know. All we have to go by is what we hear on the news. But at some point, those news headlines, the numbers became abstractions for me. Like I can't even wrap my brain around what 500,000 people, like what is that? It's just too much for my brain to handle. So I went through all the news headlines from Charlotte and local and state and national and global headlines and took 10 headlines from every month. And that's running through the background. So I wanted it to slip into the background like white noise because that's what the news felt like to me. And then the next layer on top is this map of Charlotte. And so I'm somehow going to incorporate those zip codes because I feel like that's an important part to tell. But I'm also going to incorporate some kind of strings that represent like the way the hospital had to reinvent itself. So on this end, there'll be like kind of squares because that's what the hospital was like in this entrenched kind of system of the way that it did things. And then it had to, I think it was Dr. Kenil Coltman that explained it like an anthill. And she said, it's kind of like an anthill. Like when you kick an anthill, the ants go scurrying everywhere and it looks like chaos, but it's not. They're just, there's a sense of urgency and they're trying to rebuild their system on the fly. And so that's kind of my aim is to try and capture that. So there'll be it'll go from those geometric shapes towards this side where the hope is and the pearls and the triangles. And so I asked everyone that I interviewed if they would write some thoughts on those triangles about what they thought were the pearls, what they thought could help us move forward. So maybe Dr. Calloway wants to talk about what he wrote on his triangle.
Yeah, maybe you can show it. And so that's the I Ching symbol for chaos, and it's chaos is where brilliant dreams are born. And then the next part is live with courage and joy. And so I played soccer in college and for a little bit after college, and I hadn't played in about a decade. And I started watching these documentaries on Premier League teams, and there are these two famous coaches. And throughout the season, they kept saying, boys, you have to play and live with courage and joy. And I thought about that. And I was like, this is how I want to live. And this is how I want to see my daughters live. And this is what I want to personify. Courage and joy as you're facing chaos. And really the opportunity that chaos offers us. It doesn't have to be something that's scary. It can be something that really opens up creativity and a window to a better world.
And Janelle, I just want to say, because I don't know if I was early on with Anna, but I maybe in the middle, and it's really easy as humans to go dark, right? Like to think about all of the bad things. And I'll tell you, there were, weeks at a time, and Dr. Calloway probably felt this, Ron felt this, where there was such a heavy burden on the folks that worked in the health system, because not only was there chaos, there weren't a lot of pinpoints of brightness and hope, right? We were really looking for treatments and interventions and, seeing people die at rates that we hadn't seen in our careers. And I always tell everyone I'm in the first year of my fourth decade in healthcare and have never seen anything like this before. And I think so it's really easy to go dark. But what I said to Anna was there are so many opportunities for hope when it's the darkest, right? You just have to look for them, right? So think about all of the mothers who had the opportunity to spend the first year of the lives of their children because they work from home, right? Like I go, that would have been really I mean, we all hate being at home and we all want to go back to the office, but if you look at it from that perspective, the ability to spend time with your children in your house, now it's probably too long now, but I mean, there was positivity in that, right? And I saw people step up to the plate in ways to help their neighbors go shopping or bring things or get things or make things, where you go, the sense of humanity and connection, I think was so I just said, let's not go completely dark, because there's so much wonderment and goodness that has come out of this. And I think that's what we should celebrate. So I'm really excited about the triangles, because I think I think we're hopeful as humans, right? And we do look for that joy. And you know, my joy is both of my parents are finally vaccinated, and I'm going to see them for the first time in 18 months. And for me, that's like emotionally overwhelming. And everybody is having that. So I hope what everyone gets from Anna's work is, even in the chaos, even in the darkness, there's still the sense of resilience of humanity and love and joy that that comes out of it. So, and I'm looking for those triangles.
Hey, Janelle, can I just add something and build off what Ruth just said? If I'm not on mute, but I think an important point. I just want to again tie this back to the work that Anna's doing, that you're all doing. So in chaos and in crisis, there is always an initial vacuum of information, and then there's an overwhelming amount of information that comes in, and it is very important to set the narrative early in order to succeed. And so Ruth's point is accurate, but it requires intentional thought and intentional action, because we are not, I mean, we know this, right? You look at the polarization of our community, the seeming polarization of our communities because of this bombardment of social media and digital information, that if we are not intentional about setting our narrative to say, we are resilient, these are our objectives, this is how we come together, look at these individual small acts of courage and these individual acts of sacrifice, and they are not just one person acting, they are weaving a stronger fabric of society and a stronger community. If we set that narrative, then we come together. And if we don't, this is where we fray at the edges. And so, again, we were very intentional about setting a series of narratives throughout this. But this work right here is, again, how you bring the whole community together and say, look, we previously, and Anna's getting at this, but we had a static, relatively static society that had stovepipe hyper expertise in everything. If you're a banker, you did mortgages. If you're a cardiologist, you did cardiology. And what we realized when we talk about the network problem is COVID came in and showed us, like, it touched every single person. And no matter what you did, no matter how you defined yourself as a doctor, a dad, a Democrat, a Republican, a veteran, whatever, it didn't matter, because everyone was affected. And so if we pause for a moment and think about that revelation, that is the same revelation that we need to address climate change, poverty, education, gun violence. None of these can be solved by any one or two groups that are formed in a linear, conventional problem-solving team. It needs this whole of community approach. And I hope that that's one of the lessons we take out of it. And I hope that's one of the lasting messages from Anna's work, is that we can come together. We don't need to be stovepiped. And really the big problems that face our communities require that of us.
So I'd like to kind of tag on a little bit, if I could. In a perfect world, Anna's work would be, she would do it after the pandemic is over, right? But she's had this opportunity, and we've had this conversation early on that we probably are all like, this is going to happen a couple weeks and we'll be back to normal. So, and of course now we are several months, a year later. And so Anna, I've had that conversation often about this, and in a perfect world, like I said, she would do this, after the pandemic was over and have the opportunity. But I think one of the beautiful things about this project or this work is that she's doing it right in the middle. and she's capturing these little nuggets as she's able to, and it's going to help us tell the story. And she did say, you know, at some point I've got to stop and tell the story, right? So I think a year in the life of COVID, and I think, and I might get a little emotional. I think probably in 20, 25 years from now, when we're able to look back on this and say, I remember when, you know, we can tell grandkids or kids or maybe some great grandkids that we lived through this time, this era, and it was important to be able to tell this story. And so when I saw her work and we began to converse back and forth, it was just like, I felt like, you know, she's going to have this wonderful opportunity to, and she's done, I can't even tell you how much she has dug in. And I'm like, the things when she shows it to us, I'm just like, it blows my mind, the things that she has done already. And so I can't wait to see a finished product. And I remember her talking to Dr. Passaretti, and of course she's our medical director over infection prevention. And she was asking all these different questions back and forth. And, you know, Dr. Passaretti is a straight shooter. She's just straight to the point. And we get to the end of the conversation and Anna says, well, let me ask you a question. Those little vials of the vaccines, when you guys are done with it, you know, what do you do with it? And I was like, what kind of question is that? In my mind, I thought, what kind of question is she asking her? And she's like, well, I think there's this and that we have to do with some kind of biohazard thing, but let me ask the pharmacy. And within an hour, they were telling me that they were going to save all these vials and all these things for Anna to be able to utilize to help us tell the story. And we were right in the middle of vaccine operations, I think up at the Speedway and the Bank of America, and we were all exhausted. And to be able to just help, it's not just the professionals that have been a part of the interviews, right? It's been the pharmacists, the clinicians, the people that are on the front line that are helping to tell this story. And I think it's important. And so I'm excited to see every single thing that comes out of this.
And I think as someone who is not a part of the process, but kind of seeing some of the work and hearing the process, it's really exciting. And I almost feel like, you know, while COVID is awful, it was a unique opportunity for this work to happen and for this kind of reevaluation of like how we function and what we do and how to solve like our larger problems. Like it was a unique moment for all of this to kind of come together. And then to have this record that is not only made, I think, by Anna and data, but then also by the hands of other people. Like it really is a very kind of unique moment and process.
Yeah.
And yeah.
I get chills just thinking about it, right? I mean, I'm sitting here now just like I'm trying to hold back the tears because it's been a really hard year for a lot of folks. I'm an extreme extrovert. Obviously, I would love to be on a stage somewhere at some point, but to Ruth's point, we needed, it almost like the world needed a reset, and we've gotten an opportunity to get a reset. But then I think about the number of people that have lost their lives, and the fact that Anna's going to be able to capture some of those darkest moments, and then to showcase how we moved and we went fast. We pivoted in such a way that we went from our normal community relations and community engagement work of going to galas and events and things of that nature and rubbing elbows and talking and making relationships with businesses to giving out masks in the community and finding ways that we could prevent our neighbors from catching COVID, because we learned really quickly that we had kind of escaped this level of humanity that we needed to kind of bring it back to just, hey, let me care for my neighbor. I'll do whatever. I'll work these long hours. I'll do whatever it takes to get us back to some sense of normalcy. And so I'm happy that, you know, I'm happy that we crossed paths. I really am. I think she was the perfect one for this opportunity.
And I think, you know, again, Dr. Calloway, Ron, the 50,000 plus individuals that work at Atrium Health day in, day out. I mean, these folks are true heroes. I know a lot of people were touched by COVID, you know, people's in their homes and their families. And we have heroes that came to work each and every day to care for people and put other people's interests first. And so that's where I see this hope and this sense of humanity, watching the teammates that I have just the absolute pleasure of working with, putting themselves forward. And so I would be on calls with the large businesses who would be worried about how many ICU beds do you have open and do you have enough ventilators? I'm like, what you should be asking me is who's making sure we're taking care of the caregivers, because and I mean, 6, 8 months in, these people have not stopped, and now we're a year in. And so I hope, Anna, also that when people look at the work, they also think about the thousands of people who have cared for others on the front line each and every day, because that in itself is a story. There's so much selflessness that occurs, and, the nurse at the bedside, Dr. Calloway, and the ED, the pharmacist, the environmental services, people who are cleaning the rooms and making sure that people are safe. And so I sometimes go, well, why did I get in healthcare? And then I just get all goosebumpy because I go, I'm so glad I'm in healthcare. We had an opportunity to really make a difference at a time where, again, humanity was tested. And I think the folks at Atrium Health have stepped up to the plate and passed the test. So very, very proud to work with these wonderful men, and so glad that Anna's capturing the story. It's an important story.
Wow. Well, with that said, I mean, I think that's like a perfect place to kind of leave the conversation. I know, Anna, that you'll be working on the piece. It's not done yet. But we look forward to creating an opportunity for people to see the end result. But then I think also for me, again, I really look forward to seeing how the story is really kind of framed by everyone that's involved, because while Anna's hand is like making the work, and excuse, my dog is complaining now really loudly. But while Anna is kind of guiding the process, the fact that you have, like, each of us has an opportunity to kind of add a piece to bring our own kind of experience, because this is also a very shared experience. And I think, Dr. Calloway, when you were talking about this idea of like not being able to have that stovepipe experience anymore in this network, like this, while everyone's experience may be different, this is definitely a common denominator for all of us. And so I really look forward to the opportunity to have people experience the work and bring themselves to it. But then also, I'm thankful that this has all been an opportunity for us to also learn and shift in a way that we may not have in the past. It's just great to hear, like, health, and not, you all are individuals, right? And we've established that, but as a part of the health system, it's really great to hear this idea of like community and passion and hope from that space. So I thank you all for that.